এবার হসপিটাল ওয়েস্ট ম্যানেজমেন্ট কি ওয়েস্ট হতে পারে বলো? হসপিটাল ওয়েস্ট ম্যানেজমেন্ট কি ওয়েস্ট হতে পারে হসপিটাল? বসে বলো। Mask, gloves. Anything else? Any other waste? He's saying mask, gloves. Anything else? Huh? Needle, syringe. Anything else? Mask, gloves, needle, syringe. Anything else? Huh? Anatomical parts. Very good. Okay, cotton. Very good. I think you've covered a lot of things. So that is the thing. Anything else? Anything you missed out? Something else? Huh? Syringe. Polish. Huh? Body fluids are glass vials are kichu. Anything else? Common thing which you miss. Achha, anyway, we'll go to this. So, hospital waste management. So, we have one important thing that we missed. Biomedical waste, and second one is general waste. Now, what is general waste? General waste is key. Syringe is not a general waste. Syringe wrapper is general waste. General waste. What is general waste? General waste is key. Bolo. In a hospital, what is general waste? What is the general waste in the hospital? Hospital is general waste key. What is general waste in the hospital? No, syringe is not a general waste. Syringe is not a general waste. What is the general waste in the hospital? Huh? Key? Cotton is not a general waste. What is general waste? Think, use your normal? Normal domestic waste. Can you be specific? Normal domestic waste board, but can you be a bit specific? Huh? Not cotton. Bolo. Food, yeah, food. Food is a fancy rasta. Okay, food, paper, that is the common domestic waste. Okay, so that is the general waste. The rest, all the others come under biomedical waste. So any waste generated during diagnosis, treatment of immunization of humans, animals, or in research activities. Okay, not just hospitals, even laboratories come under this. Okay, not only hospitals, laboratories or anything doing research in animal research activities. So how much waste is there? How much waste? Acta syringe, acta needle, acta gloves. This is what the figure says. Per bed, per kg, per 1 kg per day per bed. Okay. So 100 bedded hospital will have so many cases. So that is out of which 85% is general waste, which is non-infective. 15% is only biomedical waste. So, and 5% is chemicals and radioactive waste. So this is the general picture. 85% of waste is a wrapper, paper, all the stuff, which is not infectious. 15% is, 10% is biohazardous. 5% is chemical and radioactive waste. Hazardous but not infectious. Okay, is it clear? Biohazardous, infectious, 5% chemicals and radioactive waste. Now, what are the risk factors of, what are the health hazards of waste? The bode acho, can you be specific? Ki hote pare? What infection? Hepatitis B, yes, what other thing? What else? Hepatitis B to bolla, what else? HIV. Hepatitis B and HIV among people who get needle pricks. Then you can also guess gastrointestinal infections, zoonosis, injuries. The glass may hit your leg or something, particularly if the rag picker, or even a nurse, when you're cutting an ampule, the glass might hit you. Poisoning, there are certain chemicals and all which are there which can cause poisoning. Cancers, they cause cancers also, plus genetic mutation also. So all these are hazards of biological waste. Okay, infection, HIV, hepatitis B, hepatitis C. These are the common health hazards of waste. Who are the people who are affected? Healthcare workers, that is you and me, doctors. When you are going, even students, you see blood, you are handling that. You are handling some other product. You are handling a needle. Then waste handlers and rag pickers. So these three categories, in the first category, all of us fall into that. As students, as medical professionals, we are all following the healthcare providers and patients. So how do we manage it? First is ownership. Ownership means who is going to take care of the problem. Is it the government? Is it the private hospital? Is it the public? Second, minimization. Then collection and segregation. So you have to collect it and segregate it. Segregate means separate it, different categories. Okay. Now what is happening now? If you go to a marriage function or some function where you have to have food, what happens? The plate is kept there, right? Somebody takes the plate. Some places what they do, they have bin, you take the plate and go. Some places they have two bins. One plate, you throw the chicken, fish, whatever, and the other plate, you just throw the rest of things. So they're segregating that part. So that is called segregation. Fourth one is storage and transport. And fifth one is final disposal. Okay, treatment and disposal. So till 1998, remember, just imagine, the medical business has been for so long. Till 1998, there was no rule regarding biomedical waste. Only in 1998, the government thought of this rule. It will be the duty of every occupier of an institution generating biomedical waste, which includes a hospital, nursing home, clinic, dispensary, veterinary institution, animal houses, pathological lab or blood bank, to take all steps to ensure that such waste is handled without any adverse effect to human health and environment. Just a general question to you all. How many of you have close relatives who are doctors? How many of you have very close relatives who are doctors? Parents, doctors, haath tolo. Parents, uncles, aunties, doctors? Nobody? Don't be famous. What I'm saying is, okay, there may be relatives of yours having a laboratory or clinic. You may also be starting a clinic in the future. So, but these rules are important. Okay, these rules are very important. Aage rules chilo na, but it is the duty of every hospital, doctor or health provider to ensure that all waste is handled without any adverse effect to human health and environment. That means, ekhane laboratory ache, tomar building ekhane, you take all the things, throw it there. You cannot do it. If you do it, there will be fine, you can go to jail also. So what is the penalty? Imprisonment up to 5 years and fine up to 1 lakh. And if you can't pay the fine, then you will be in jail up to 7 years. So it is, this penalty is there. Previously, they used to throw it. That is no longer there. Okay. This is the amendment in 86. So then what is next step? Waste minimization. Now how can you minimize waste? You are running a big hospital. How can you minimize it? You can't minimize everything. You can't tell them, don't take food. You can't tell them, Operation Corona. You can't tell them, cotton fell on them. But reduce, reuse, recycle. These are three principles. Reduce, reuse, recycle. That is the three principles for waste minimization. So then is collection and segregation. So collection is at the point of the waste generation. Okay. Using color-coded bins. Different category waste should not be mixed. So somebody mentioned syringes. That should not be mixed with something else. It should not be mixed with cotton. Everything has got its own color code. So that's what is color code business. You have 3-4 bins for like this. Have you seen such a bin? Hospital dekhecho? Dekhecho ki na? Dekhecho. Next time when you go to bhalo kore dekho, you ask the sister or somebody in charge to explain also. Okay. So each of them has got a different color. You have a blue color, a red color, yellow color and a black color. These are 4 colors for segregation. Now what do you throw? How do you throw what? सब तो आके रकम देखते हैं. So we have what is called infectious waste types. Soiled or pathological waste. Somebody said from here pathological waste. Somebody said about, you said. Second thing is sharps. Sharps means your needle, the syringe, it can even mean a scalpel blade, anything of sort. It can mean an ampoule cutter, then plastics. So these are infectious waste types, this of which the soiled and pathological waste, they go into the yellow bin. So what are the things? Soiled and pathological waste? Dressings, bandage, swabs, plaster of Paris cast, what do you do for your orthopedic cases? Tissue waste, theatre and labor room waste, anatomical waste, all this goes into the yellow bin. So remember, infected and soiled or pathological waste go into the yellow bin. Okay, is this clear? It's a bit confusing. I know it's confusing. It's confusing for me also. Soiled or pathological waste, dressings, bandages, swabs, POP casts, tissue waste, theatre, operation theatre and labor room waste, except they all go into the yellow bin. And once they go into the yellow bin, after what happens? After the yellow bin, it has to eventually go out somewhere. It is incinerated or deep burial. Incinerated means putting in a place and just burning it off. Okay, that is called, we have special equipment called incinerators. And deep burial, you can't just bury it right there on the ground, you have to go very deep into it because it has transparent, like fully normal glass. Translucent is slightly hazy, like you have a window glass, something like that. That is translucent. So here, translucent puncture-proof containers. Okay. So why is that? So that you can see it. You can see the cover. Don't put your hand unknowingly. You should be able to see that it contains a needle. That is why this blue, they are put in needles, broken glass, lancet. Lancet is, what is lancet? Any idea what is lancet? Lancet to kijana. What is a lancet? What is a lancet? Huh? Yeah, lancet is what you, that small thing which you prick looking at blood sugar and all. That is called a lancet. Not needle, it's a smaller needle. Tukkure, you won't feel the pain. That is called the lancet. So lancet, then blades, IV cannula. Have you seen IV cannula? Okay, IV cannula. All this go into the blue bin with white translucent puncture-proof containers. Okay, that should be puncture-proof. So this is how the blue for sharps. Okay, a bin hai, fill it out. Then again, what happens to the sharps after you get so much things in the blue bin? You need chemical treatment. And you have to be destroyed. The sharps need to be destroyed because if you keep moving the sharps, it will land on somebody's leg. That person will get injured, or somebody will get infected with hepatitis B or C. So that has to be destroyed. Then shredding, again autoclaving, and also there's something called a sharp pit. So all needles must be cut and destroyed. Again, when we were studying, we had, somebody mentioned glass syringe. Who mentioned glass syringe? Somebody mentioned glass syringe. From that side. Glass syringe. Yeah, you mentioned glass syringe. So those days we had glass syringes. So glass syringe means one same syringe, 50 people would be given the injection, then you would put in the autoclave, sterilize it. Then that time hepatitis B and all cases increased, HIV came. Then they said, let's go for the disposable syringe. Disposable syringe also, it became a big industry. What is the industry? Disposable syringe, you throw the syringe out into the waste basket. The raddi wala or the bikri wala, he takes it up. He breaks the needle, he sells it, and he gets money out of it. 100 or 1,000 needles, he makes maybe those days 100 rupees a kilo, something like that. Just giving it 20 rupees a kilo. You would go to all the nursing homes, break the needles, and sell the metal. Okay. She's getting surprised. This used to be the practice. This actually happened. Okay. And that's why they said needles should be cut or destroyed. So they told us if this is a needle, you break it like this so that it will not be used again. You break it like this. And then all sharps should be immersed in chemical disinfectants like 10 gram bleaching powder per liter of water. Okay. Then again regarding needles, do not recap the needles. Don't put a cap again. If you've taken out the cap, make sure it remains there. Do not, previously it was, we used to bend and break it. Do not try and bend or break the needle. Do not manually remove needle from syringe. Do not manually remove needles from one container to another. These are the don'ts for, most important thing is, do not recap the needle. Okay. You have taken the needle like this, take it out, don't recap it. Once you have taken it out means, you're going to use it somewhere. Don't try recapping it. Okay. And this is something different. We have an auto disposal syringe. You give the injection, you cannot use the injection again. So you just bring it back, it suddenly stops. There's a valve mechanism, it just stops. Then how do you get rid of the needle? You put it in the small box over here, you can see, and you just turn it automatically. The needle will be broken, not the syringe. Needle will be broken. So that needle cannot be used again. Okay. This you should be able to see it in the wards. So you ask the sister, this auto disposable syringe kiko hoy, this is how it is. Okay, the needle is destroyed. Can you follow? The needle is destroyed, so that there's no chance of it being used again. So then you have this again, same, the needle should be put in that box over there. The needles are destroyed. Needles are the major cause of all the problems, whether it's injury or whether it's hepatitis B, hepatitis C or HIV. So needle should be destroyed. So you have a hub cutter. This is called a hub cutter. Needle is put there and literally the needle is kept there and you just turn it, it breaks. Okay. Then this is a sharp spit. Now what is sharp spit? Where you can actually bury the needles and all. You obviously need some land for it. Many nursing homes are in small areas, there's no land. But when you're making it, this is the format. You must have a concrete slab at the top. You must have a steel pipe going like this. Then you must have 6 feet diameter. Then again you must have a lining of brick. After that, only you can put the needles. You can't just put it, just mati thoda lagta parvena. You need a gap of 6 feet at least before you can put the needles. And then the water level table also. So a lot of things, this is the guidelines set by the government of India. As per WHO, this is how the design of a sharp spit should look like. So you cannot just, can I fill it, that's not possible. So this is the way, there's certain measurements are there. 6 feet diameter, not less than 6 meters from the water level table, and there should be concrete lining, and all these things are there, all specifications are there. Okay. It na hole, we cannot have the sharp spit. So if you're having a sharp spit properly, it should be like this. Then comes the plastics. Plastic is a big, nowadays plastic is making more news than anything else. For everything they say ban plastics. But here we have plastics in IV lines, syringes, Ryle's tube, urinary catheter, Eurobag. All of them go into the red bin, okay. Because it's plastic is dangerous, so that's why all this goes in the red bin. And then again, what happens next? Chemical treatment is there, and then autoclaving or microwaving. Okay. So once it, from the red bin, it goes for chemical treatment, autoclaving, and microwaving. Then chemical waste. What are the chemical waste? You have actual chemical waste, discarded medicines. Very often you find discarded medicines. Discarded medicine means somebody needs 10 tablets of Rantac. He has taken only 5. Discarded medicines. Hazardous waste. All this comes again under the black bin. Okay. So all this black bin, everything is disposed in a secured landfill. Now the problem here is this landfill is an open space where it is actually filled by this waste. Okay. Now the problem with this thing is that not everywhere you have so much land. So for example in Kerala what they did was 15-20 years back, the Indian Medical Association said that we have identified some land, so many acres of land for the medical waste. So all hospitals, they would be given a chance to send the waste through the IMA. The IMA would send a truck. I don't remember the rates. So much kg of waste, so much money you give, daily a truck will come. So the land was filled up. Then gradually it became a big sort of mountain. Then the neighboring people, they started objecting. Gondo beroche and all this stuff. And now there's no land for it. Now they're looking for another plot. So landfill is a place again where we cannot, unless we do have that much land, we cannot do it. Okay. So disposal finally in secured landfill. Now then comes the storage and transport. So you have the bin here, you have to transport it somewhere. How will you transport the bins? Again here, the lid that should be covered, color coded bins, and transport should not be very far off, and that bin should be empty when it is 3/4 or less than 24 hours there. Okay. Now what is happening now if you take a look at, I'm not finding fault with anybody, but I'm just generally saying, if you find a bin without a cover, what happens? Any bin without a cover, I'm throwing something over here. You are throwing something else over there. What happens next? What happens next? He's throwing, you're throwing, I'm throwing. Bin is open. What happens next? Contamination, that is one thing. Second thing, which is commonly seen in our campus. Huh?
Littering.
How littering? Yes, animals. Somebody kicks it, or dog jumps over, dog kicks it, or whatever, whole thing falls off. So that's why covering the lid is very important. Okay. Dogs is there on other places, not just our campus, but I'm just saying, empty when it's 3/4 or full, empty it. Okay. We often see many places, even if you go to some restaurants, you'll find that they have the waste, but it's almost bulging at the seams. So when it's 3/4 full, empty it, or within less than 24 hours. Avoid spills and leaks. Use bags with same color as the bins. So that is for easy identification. So if you have a red bin, use a red bag. If you have a blue bin, use a blue bag. If you have a black bin, use a black bag. Never mix different category waste and use trolleys to transport. Now remember this, we are all humans. The health workers are human, you are a doctor, you are going to be doctors, you are humans, nurses are also humans. The people who handle the waste, they are also humans. So they should also be given some consideration. Okay, so use trolleys to transport, and handling people, the people who handle waste, they should be trained how to handle waste. Okay, so they will say, "Amar kaaj na hai, eta amar kaaj na hai." That is one thing. Second thing is, how should they handle waste? They should use protective equipment like gloves, masks, boots, aprons, etc. And there should be also occupational health things to be done to them. For example, they should get Hepatitis B vaccination in case they have not got it. Second is personal pre-exposure prophylaxis and personal hygiene. So these are the things that are important for handlers of waste. Okay, so it's not that they come and they say, "Kiya cha, nahi achi," but they should get protection. They should get gloves. They should get masks, boots, aprons, etc. Personal hygiene. These are things which are there. And this is a symbol you'll see in those things, biomedical waste. It's not the Olympic symbol, but it looks somewhat similar to the Olympic symbol. 3 circles, but you'll see biomedical waste, handle with care. Okay. So please follow that when you see the thing, it means something is wrong. Be a bit careful. Don't just walk around with it. And general wastes are generally what we talk, they're non-infectious, packings, medicine packets, leftover food, wrappers, papers, general office waste, kagos. They go to the green bin, which is no issues, and they are biodegradable, so you can go for composting, and non-biodegradable can go to the municipal waste. Okay. So green waste, general waste is not a major problem. General waste goes to the green bin. Okay. So now this is a photograph of the real photograph of an incinerator. So here is what happens. All the waste finally lands up here, and it is burnt. Okay. It is burnt, and the the smoke goes up quite high, and it's usually situated some distance away from the main hospital, but fair close enough. So that is where the final disposal of the waste goes, in the incinerator. Usually it's some distance away from the hospital. And this is another example of the incinerator at a hospital. The hospital is there. You can see the incinerator tower outside. Okay. This is the incinerator tower that's there. Now, so because this is a tower, this is the chimney of the incinerator. Okay. So that goes to outside. So that's basically all regarding biomedical waste management. I hope you got some idea. What are the common questions which are asked in the orals as well as theory? These are the questions. Define and classify hospital waste. You have got idea of what is defined, what are types of hospital waste. The second one is describe various methods of treatment of hospital waste. The third one is describe the laws related to hospital waste management. The biomedical law of 1995. And again, short notes you might be asked. Disposal of sharp waste in healthcare management, principle of biomedical waste management, and segregation, or what are the 3 R's? Okay. Then some more questions in the MCQ may be asked. What does blue color and coding stand for? What does black stand for? What does green stand for? They won't ask you about green, but they'll ask you, where do sharps go? Which bin does sharp go? Is it goes to red bin, green bin, yellow bin, MCQ? Okay. So these are the questions which you normally ask. It's not a very big topic, but I suppose you got some idea of this. So if I ask you, you will be able to answer the questions? You can answer the question. उत्तर दिते पारबे? उत्तर दिते पारबे किना? नाले आबार क्लास पढ़ाते हैं. The second question बोलो. Define and classify hospital waste. बोलो. How many types of hospital waste? Just general बोलो. Okay, let him say. How many types of hospital waste are there? Huh? बोलो. बोलो तुम बोलो. জানো না? তাহলে আধ ঘন্টা কি করেছিলে? হ্যাঁ? হসপিটাল ওয়েস্ট কত আছে? কত রকম আছে? কত রকম হসপিটাল ওয়েস্ট আছে বাবা? Define and classify hospital waste. It is not, okay, hospital waste. বলো. বলো. হ্যাঁ? General, okay, very good. General, no, general, very good. And general ছাড়া অন্যটা কি? জোরে বলো, আমি শুনতে পাচ্ছি না। অন্যটা কি বলো? হ্যাঁ? General and specific, আচ্ছা, not general and specific. Anyway, general বলেছে, so I'll go to the slides once again. কিছু লোক গল্প করছিল, so I'll go to the slides fast again. He's saying general and specific. It's like asking. So I just go to the slides fastly. So he said, general waste and specific is the definition. You can see it in your books. How much waste per day? What are the health hazards? Who are the people who are affected with this? How do you manage it? Segregation, minimization. Minimization মানে কি? What is minimization? Reducing, okay. Segregation? Separating, okay. Segregation, separating, collection, segregation, storage and transport, treatment and disposal. This is a biomedical rule management. I suppose you know this, you will be able to write, if they ask you, main things, what is the duty, what is the fine, 1998 rules, and what is to be done, what is the penalty, imprisonment up to 5 years, and fine. If you can't pay the fine, imprisonment up to 7 years. Then waste minimization, what are 3 R's? Reduce, reuse, recycle. Collection and segregation, use color-coded bins. Different category waste should not be mixed. These are color-coded bins. There's also one more bin with this, which is not the green bin, that is for general waste. Okay, so this you know, what are the waste? Infectious waste all goes in the yellow bin, and which is, it can infect other people, and eventually that is incinerated or deep burial. Incineration means burning it, okay. Then sharps, blue bin, with puncture proof containers. These include needles, broken glass, lancets, IV cannula, etc. They are put in the blue bin. Then again chemical treatment with disinfection, destruction, shredding, autoclaving, sharp pit. So all needles must be cut or destroyed, should be immersed in chemical disinfection and with 10 gram bleaching powder. And this is a general rule regarding needles. This is how you dispose of it. And finally put it in the hub cutter for cutting the needles. Design of a sharp pit is kept right inside the quite some distance under the level of. Then plastics go into the red bin, which is because we talk about plastic toxicity. All these plastics, IV lines, syringes, Riles tube, catheter, Eurobag, etc. Then treatment again, chemical treatment, autoclaving and microwaving. Chemical waste, they go into black container because they are also discarded medicines, hazardous waste. Treatment in secured landfill, which is somewhat some distance away. Storage and transport in same bins. Don't mix the thing. You empty when it's 3/4 full or under less than 24 hours. Use trolleys to transport. Train and take care of the healthcare workers who are transporting these things. They should be using protective gear like masks, aprons, boots, gloves, etc. They should also have hepatitis B vaccination and post-exposure prophylaxis. If PEP is post-exposure prophylaxis. Suppose they accidentally hit a needle and that patient is supposed to be HIV positive. What is to be done? If There's a patient and that patient's blood product or something is hit with the health worker's hand. And that patient is HIV positive. What is to be done? What is to be done? If a patient is HIV positive and a nurse has taken the blood and somebody's blood has touched it, what is to be done? Huh? Okay, so she's saying an important thing. Your friend is saying important. She's saying if there's an accidental prick, you first do if there's an accidental prick on the finger and the patient is suspected to be HIV positive, test for HIV positive, refer to the higher hospital, government hospital, and start on pre-exposure prophylaxis. Okay, that is what is called PEP. Okay, post-exposure prophylaxis. You've been exposed and you're starting the antiretroviral therapy. No need to panic, but just prepare to be safe because you were not wearing gloves. The blood or something of the HIV patient touched you. No need to panic, but you have to take the medicine as prescribed. Antiretroviral therapy. Okay, and personal hygiene. Then this is a symbol for biomedical waste. General waste are put in the green bin. Biodegradable goes to composting, non-biodegradable municipal waste. Then this is a picture of the incinerator. These are common questions which are asked. I suppose you can answer that, I hope. And that's all from my side. Thank you.